This video lists a countdown of the top 10 most terrifying pandemics before COVID-19 in the order of the number of deaths caused by the disease. Please like and subscribe if you want more videos like this, or comment down below what you'd like to see next. Let us begin with the least in our spot, the Russian flu. The Russian influenza, also known as the Asiatic flu, was known as the last great pandemic of the 19th century. The outbreak began in October 1889 up until December 1890, with reported recurrences until early 1895, and took the lives of about 1 million people worldwide. At first, the strain was thought to be an outbreak of the influenza A virus subtype H2N2, but a study in 1999 found the cause to be the influenza A virus subtype H3N8. However, a genomic virological study from 2005 says that the virus might have been not an influenza virus, but human coronavirus OC43. The virus easily spread worldwide since there was no standard treatment for flu during the time. Many people thought that aside from medication, whiskey, brandy, linseed, salt, and warm water, and glycerin would be enough to treat the disease. In addition to this, modern transport infrastructure, major roads, rivers and railway lines assisted in the spread of the Russian flu. Another issue is that some doctors gave poor medical advice to patients by claiming that the disease was not contagious and that fasting would starve the fever, based on the belief that the body would not produce as much heat with less food. Top 9. The Asian flu. The Asian flu began in early 1957 as an abominable flu outbreak in Guizhou, China, caused by the influenza A virus subtype H2N2. This pandemic is caused by a new strain of virus from the recombination of avian influenza virus and human influenza virus. Thus, immunity against the virus would be low. This pandemic has spread from China to Singapore, Hong Kong, Taiwan, India, United States, and the United Kingdom. The first wave mainly affected children who went back to school after their summer vacation. However, the second wave affected elderly people more, thus making it more fatal. The Centers for Disease Control and Prevention estimated the number of deaths to be 1.1 million worldwide. Maurice Hillman, a microbiologist, requested samples of the virus be shipped to the United States to work with vaccine manufacturers. By October 1957, the vaccine was made available in the U.S. Top 8. The Italian Plague. The Italian Plague, also referred to as the Great Plague of Milan, was brought by the infected troops movements during the 30 Years' War. The disease first reached Mantua in 1629, which soon spread to major cities of Italy, including Florence, Milan, Venice, and Verona. It has been said that city authorities in Venice and Milan confined sick patients in pest houses and burned their belongings to prevent the spread of the virus. Some of the plague victims were also exiled to a pair of islands in a nearby lagoon. The Italian plague lasted until 1631 and possibly took 1 million lives, which is about 25% of their population. The disease was also considered as the cause of the decline of Italy's economy as a major player on the world stage. Top 7. The Antonine Plague. The Antonine Plague broke out on 165 CE during the height of the Roman power throughout the Mediterranean world. This plague was named after their ruler at that time and the last of the 5 good emperors, Marcus Aurelius Antoninus. The Antonine Plague is also known as the Plague of Galen the physician, who described its symptoms and course. This ancient pandemic was brought to the Roman Empire by the Roman army, who were returning from the wars in the east, and spread everywhere they went. The pandemic lasted for the next 2 decades, causing the decline of the Roman Empire. The disease slowed after 180 CE, but flared up again in 189 CE before finally settling down. Roman historian Dio Cassius said that Rome experienced up to 2,000 deaths per day during the peak of the outbreak. The Antonine Plague not only devastated the Roman army, but was also speculated to be the cause of deaths of both emperors. Lucius Verus, who died in 169 CE, and his co-regent, Marcus Aurelius, who died in 180 CE. Based on the information provided by Galen, scholars have concluded that the disease affecting the empire was most likely smallpox. The death toll was estimated at 5 million and killed as much as 1/3 of the population in some areas. Since not all who caught the disease died, those who survived developed immunity from further outbreaks. Top 6. The Third Plague. The European continent has a long history with plagues. The Third Plague pandemic refers to the third major bubonic plague outbreak to affect European society. The previous 2 were the Plague of the Justinian and the Black Death, both of which made it to our list. This episode of bubonic plague began in 1855 in Yunnan, China, and the World Health Organization considered it active until 5 decades later, when cases dropped to 200 per year. The third plague spread to all inhabited continents, and by 1960, the pandemic had already taken the lives of more than 15 million people, with about 10 million killed in India alone. Top 5. The New World Smallpox. Since Christopher Columbus's arrival in North America in 1492, the native inhabitants of America, who lack immunity to Old World viruses brought by the Spanish, fell victim to terrible plagues of smallpox, influenza, and other viruses. Hernan Cortés, a Spanish conquistador and explorer, landed on the shores of what is now Mexico and what was then the Aztec Empire in 1519. A year later, another group of Spanish explorers who inadvertently brought along an African slave infected with smallpox arrived in Mexico, and by mid-October, the virus was sweeping through the city. Afterward, the disease spread rapidly on Tahuantinsuyo, or the Inca Empire, and claimed between 60% and 90% of the Inca population. Even after the two largest empires of the Americas were defeated by the virus and disease, smallpox continued its march of death. For more than 200 years, this disease affected all New World populations, mostly without intentional European transmission, from the contact in the early 16th century until possibly as late as the French and Indian Wars, 1754 to 1767. The death of 90 to 95% of the native population of the New World was caused by Old World diseases. According to a study published in 2019, starting from Christopher Columbus's arrival in North America in 1492, the lives of 90% of the native population in the Americas perished, which means that about 55 million people were deceased because of violence and never-before-seen pathogens like smallpox, measles, and influenza. From these calculations, the death toll represented about 10% of the entire Earth's population at the time. Top 4. The Plague of Justinian. The Plague of Justinian or Justinianic plague was a contagious disease caused by the bacterium Yersinia pestis. The outbreak took place in Constantinople during the reign of the Roman Emperor Justinian I in 542 CE. The disease was believed to have originated from China and northeast India and was brought by black rats which traveled on the ships and carts transported to the Roman Empire by land and sea trade routes. In 2013, experts confirmed that the cause of the Plague of Justinian was the same bacterium that caused the Black Death. The plague continued to spread throughout the Mediterranean world until 750 CE. Procopius reported in his Secret History that the plague kills about 10,000 people in Constantinople daily during its peak, and because there was nowhere left to bury the dead, carcasses were left stacked in the open, with funeral rites often left unattended, and the entire city smelled like the dead. However, modern scholars estimate 5,000 deaths per day in Constantinople at the peak of the pandemic. Be that as it may, the plague took the lives of perhaps 40% of the city's population and nearly 25% of the population throughout the rest of the empire, which ranges from 30 to 50 million people in total. Top 3. HIV and AIDS. Human immunodeficiency virus infection and acquired immune deficiency syndrome is one of the world's most serious public health challenges. HIV/AIDS is a spectrum of conditions caused by infection with the human immunodeficiency virus, HIV, which weakens the immune system, making it harder for the body to fight off infections than some kinds of cancers. HIV is commonly spread by unprotected sexual intercourse, contaminated blood transfusions or hypodermic needles, and from mother to child during pregnancy, delivery, or breastfeeding. Since the first cases of AIDS were reported in 1981, the infection with HIV has blown to global pandemic proportions. However, the WHO currently uses the term global epidemic to describe HIV. In 2019, approximately 38 million people worldwide were infected with HIV/AIDS. 36.2 million of the 38 million were adults and 1.8 million were children aging less than 15 years old. Approximately 35 million have died from AIDS-related illnesses since the start of the epidemic. The most affected region worldwide with HIV/AIDS is the sub-Saharan Africa, which contains over 12% of the Earth's population. More than two-thirds of all people living with HIV globally inhabit this region. Unfortunately, despite advances in our scientific understanding of HIV and the tremendous efforts of the global health community along with numerous organizations, still, no cure has been developed. We also cannot deny the fact that innumerable individuals with HIV or at risk for HIV still do not have access to prevention, care, and treatment. Aside from this, HIV-infected people continue to face stigma of different forms, such as ostracism, rejection, discrimination, avoidance, and violence. Because of this, many people are discouraged from getting HIV tests or returning for their results and/or acquiring treatment that could manage the illness instead of causing deaths and exacerbating the spread of HIV. With this in mind, we at the Daily Top 10 hope that, as with other illnesses, you continue to educate yourselves about HIV, encourage those who are infected to seek treatment, and support them in whatever way you can. If you would like to make cash donations, we will be putting links of charities that need your support down the description box below. Top 2. The 1918 flu, or Spanish flu. The 1918 flu pandemic, also known as the Spanish flu, was the first of two pandemics caused by the H1N1 influenza A virus. The second was the swine flu pandemic in 2009. Despite its name being Spanish flu, the pandemic did not originate in Spain, only news coverage of it did, since Spain was a neutral country during World War I. Because of that, the media in Spain were free to report the effects of the outbreak from the start. It lasted from February 1918 to April 1920, with 4 successive waves, and infected 500 million people, about 1/3 of the world's population at the time. One unusual aspect of the 1918 flu mortality was high in healthy people, including those younger than 5 years old, 20 to 40 years old, and 65 years old and above, groups that are normally resistant to this type of infectious illness. It has been said that more US soldiers died from the 1918 flu than were killed in battle during the First World War. Victims died within hours or days of developing symptoms, their skin turning blue, and their lungs filling with fluid that caused them to suffocate. At the time, no vaccine was developed yet to protect citizens against influenza infection, and no antibiotics to treat bacterial infections related to influenza infections. The only control efforts they could do were limited to isolation, quarantine, good personal hygiene, use of disinfectants, wearing masks, and limitations of public gatherings. When the pandemic ended, the death toll was estimated somewhere between 17 million and 50 million. Top 1. The Black Death. The deadliest and most devastating pandemic known to man, the Black Death. Also called as the pestilence, the Great Mortality, or the Plague, the Black Death was caused by the bacterium Yersinia pestis, the same bacterium responsible for the Plague of Justinian. It was the beginning of the second plague pandemic and turmoil in the religion, society, and economy of Europe. Since the Great Famine during the late Middle Ages, the Black Death was the second disaster affecting Europe. That's why it took the European population until 1500 to recover to the levels of 1300. The plague was most likely believed to have originated in Central Asia or East Asia, carried by fleas living on the black rats that traveled on merchant ships that traveled along the Silk Road. The catastrophe arrived in Europe in October 1347, when 12 ships from the Black Sea docked at the Sicilian port of Messina. The people gathered on the docks were appalled upon seeing the ships with most of its sailors aboard were found dead, and those still alive were gravely ill and covered in black boils that oozed blood and pus. Although the port authorities of Sicilian hastily ordered the fleet of death ships out of the harbor, it was already too late to stop the plague from spreading. For 6 years, the plague wreaked havoc in Europe. Many people who were desperate to save themselves abandoned their sick loved ones and fled to the countryside, not knowing that they could not escape the disease, as it affected even cows, sheep, goats, pigs, and chickens. The Black Death never really ended, but authorities were able to decelerate its spread by imposing sailors that arrive in ports to be in isolation until they were sure that they were not afflicted with the disease. These sailors were primarily isolated for 30 days, Trentina, then later increased to 40 days, or quarantina, where the term quarantine originated from. The Black Death was estimated to have killed more than 20 million people in Europe, which was almost equal to 1/3 of the continent's population at the time. In total, it was estimated that the Black Death took the lives of 75 million to 200 million people worldwide,